Welcome to the EAU podcast.
Good morning, everyone. My name is Cyrille Guillot-Tantay. I'm an associate editor in the UROLUTS platform. And today I'm very pleased to have Dr. Albakr, which is urologist and fellowship actually in the Cleveland Clinic, to speak about the abstract he presented at the last AUA. So thank you very much, Ahmed. Could you maybe start by giving a small introduction of yourself and on your study?
Thank you, Cyrille, for the introduction. I'm Ahmed Albakr. I'm one of the fellows at Cleveland Clinic. I'm finishing a female urology and pelvic reconstruction fellowship at the Glickman Urological Institute. I'm very interested in functional urology, urinary incontinence, and pelvic reconstruction. And that's how we came up with our research, trying to improve the urinary incontinence in females.
Perfect. So could you maybe start by summarizing your abstract, your problem, and after we will go in the details with the question of the removability and biocompatibility of the slings, like a critical issue in urology.
Our project was an animal study in porcine models to evaluate a new expanded PTFE material used as a midurethral sling. The safety of this material was tested before in a previous test on small animals, and not as a midurethral sling, but just to check the tissue biocompatibility and showed good safety. That's why we moved forwards to apply this to larger animal models to evaluate it as a midurethral sling and evaluate its biocompatibility, risk of migration, the risk of any infection through the mesh materials. Our abstract evaluated 6 mini pigs, Yucatan mini pigs. We implanted 6 expanded PTFE midurethral slings. These were fixed in position using anchors from fluorinated polypropylene. And the anchors were fixed into the obturator foramen and the obturator membrane of these animals. And over 12 weeks, we evaluated how these animals did. And by the end of the experiment, we evaluated the easy removability and accessibility to the material that was implanted, and how was the tissue reaction for the presence of this material in place, in addition to any complications through the course of the experiment. Our results were that at the end of experiments, all the animals did well. There were no major complications related to the presence of the sling. When we evaluated the time for removability of the sling, it was very minimal, around 12 seconds. And the slings were there without any adhesions to surrounding tissues. However, they remained in place, guided by the anchors that fixed them to the obturator membranes. And we took samples after this from the periurethral and the vaginal tissue surrounding the sling, where the sling was, in addition to some tissue samples from the tissue surrounding the anchors, to evaluate the histology. So the histology findings were interesting, that they showed minimal tissue reaction in comparison to our control model, which was an animal that had no previous slings. So the normal tissue versus the tissue after the experiment showed minimal change in the collagen muscle ratio. In addition, there were minimal inflammation, minimal infection. It's worth to mention that we noticed that 3 of the animal models had a sling exposure without presence of infection or inflammation in the tissue surrounding the sling. It's worth to note that when we put these slings, they were not the exact size that should be there. The anatomy is different in these animals than human models. So we tried to give extra length of the sling in order to try to avoid putting these animals into retention, especially that they are continuously growing through the time of the experiment and changing their dimensions. So we had this extra length of the material tucked in the periurethral tissue. Our suspicion is that this exposure was not related to the material itself, And this was revealed more when we compared this into polypropylene in further steps of this experiment that were not mentioned in this abstract, or were not ready by this time.
And so the EPTFE you use, it's with sub-micron pores, and the size is quite specific, I think. Can you maybe explain us the rationale behind the design of the PTFE, particularly how the pore architecture prevents bacterial ingrowth while maintaining biointegration? And secondly, how does this compare to the traditional polypropylene slings in terms of tissue interaction?
So this is a very critical question. Thank you for asking this. And this gives us to the comparison between two materials. One of them is still present in the market. The other was removed from the market. So the PTFE was used before as the Gore-Tex materials that were used before. These used to have tiny, so they were like micro porous, but the microscopic pores in these materials were around 20 to 30 microns. This was allowing more presence of bacteria while inhibiting the growth, the presence of the white blood cells and the inflammatory action within the mesh, which ended up with major infection complications that resulted in this material be out of the market since long time. The other comparative is the presence of the polypropylene macroporous slings, which has been in the market for a long time. And these allow much tissue ingrowth between the pores. On the one hand, this helps with the presence of the mesh within the tissue without having and creating some sort of fibrosis that help with the support of the urethra and limiting the urethral hypermobility. But on the other hand, this at some point hides the material where the mesh is, making that at any point the removal or the dissection or for revision is needed. This makes it at some point challenging to find the sling and to dissect it out. At some point, it results in some adhesions that can result in urethral injury, or the need to do urethrolysis to free the urethra from the adhesions surrounding this mesh. That's why we try to seek a different material that can offer a better replacement for what's available, what we have in the market. Then we came up with the evaluation of the expanded PTFE with the sub-micro pores. This material has pores are less than 1 to 2 microns. This is meant to prevent the bacterial presence and growth inside the material, in addition to having less fibrosis and less adhesion surrounding the material. Usually it's there within the surrounding the tissue, doing its job without having any adhesions or increasing the risk of infection.
So your study showed remarkably short explantation times, about 12 seconds, with minimal fibrosis and inflammation at 12 weeks. And how does these findings, what does it tell us about the tissue incorporation of the EPTFE?
So as we spoke, the material doesn't have much tissue interaction, much tissue ingrowth within the mesh itself. So the fixation is mainly dependent on presence of anchors within the obturator membrane. On the one hand, this is important in preventing the tissue adhesions surrounding the sling. But on the other hand, the presence of this material impenetrable to the tissue and fibroblasts, at some point it starts to create a very thin capsule surrounding it and preventing any interaction between it and the tissue. And this actually what helped having this minimal time to find the sling and to just cut the ends bilaterally without the need for huge dissection.
And you also observed some vaginal extrusion in 3 animals, which was attributed to the excess length of the material. What design of surgical techniques maybe you should modify, and what would you recommend to avoid this vaginal extrusion?
So the vaginal extrusion at the time being, we really suspect that it can be related to the technical difficulty that we have, which was the extra length of the sling that was stuck in the periurethral space. And the other arm of this study that the results of which were not available by the time this abstract was submitted was the comparison between the expanded PTFE slings and the polypropylene slings. In this arm, we applied similar length slings to 6 animals and evaluated their performance. And by again, by the end of the experiment, we noted the exposure in 2 out of these 6 animals. So the exposure was not significantly different between both groups. However, we think that further data may be needed to evaluate what is the reason of exposure in presence of in absence of any infection at this time of these slings, whether it's the material or the technical exposure. But we clearly suspect that it's mainly related to the technical difficulty we had with placement of these slings. Again, why this happened was that we tried to avoid having any obstruction in these animals while they were changing in size through the time of experiment. For the animals where we have less buckling somewhere with the sling, they have the slings were covered. There was no exposure.
Okay, perfect. And so there are some studies about like the long-term complications of slings in JAMA and more recently in the clinical medicine, which is a part of the Lancet discovery. And it seems to have like long-term mesh complication with the need to remove slings removal or slings section. If we translate your study into humans, what will represent the most significant clinical advantage of the slings? It's to improve the removability of the sling for the patient, or reducing the risk of erosion, and also the risk of revision.
Yeah, of course. We read with great interest the articles that worked on the complications of midurethral slings and the need for revisions for these slings. And all the experts who work in this field know that the mesh complications, although they are still rare, but they are significant, and they can cause major comorbidity for those patients. They can cause major morbidity with managing these complications. That's why we try to find a better material to compare it with what's available in the market. The main aim of our sling is that it can stay there, do its function, and whenever there is a complication or the need to be removed, it can be removed easily without the need for any injury to the urethra or extensive dissection to take it out.
Yeah, that's a very good point. And to finish, what's the safety, regulatory, and biocompatibility evidence you will still need to demonstrate before moving into a human clinical trial?
So with the full experiment, after we compared this to polypropylene, I think we had major comparison to show that the sling can still have a good tissue compatibility and may stay there without any risk of infection. We are evaluating if this can be taken up to the next step to evaluate its safety in humans or not.
Thank you very much, Ahmed. It's a great work, and it was very interesting to discuss with you about the EPTF. Thank you very much.
Thank you for listening to this episode of EAU Podcasts. For more updates on functional urology, please visit our educational platform, UROLUTS. To keep up with the latest EAU podcasts and stay informed on the urological advancements, be sure to subscribe the EAU Podcasts channel on your favorite podcast app. Until next time, keep learning and stay inspired.